is
Lightning could hit this building, and somebody's aim could be off.
God bless you. Let's get to Tim Moore. Tim, President, CEO of Mississippi Hospital Association. Tim, are you there, sir?
I am here. Perez, seems like Paul is tottering on the edge today, isn't he?
Well,
He's out there where the buses don't run.
I've been tottering about 50 years or more. So.
Yes, sir. I am here with you, Paul. Glad to be here.
But it's seasoned tottering, though. So, you take it for what it is. How are you doing?
I'm doing well. Well as can be expected.
Oh, man, good to have you. Just let me get to the most important questions. You have an overview every single day. It's kind of collectively you get what's going on with the hospitals across the state that are members of your organization, the Mississippi Hospital Association.
Yes.
So how are we looking as far as the peak, the crisis, as far as availability of beds, all of this stuff?
And when you look at availability of beds, we seem to have a abundant capacity right now. Knock on wood. We're proud to have that and hope that continues. And we hope that we are seeing more beds come available each day, both from an ICU standpoint and also from an open normal hospital bed. At least yesterday, I think we were looking at over 200 ICU beds available and somewhere around 2,700 regular hospital beds open. So, and that's not counting UMC. That was outside of UMC. So we feel pretty comfortable about the capacity of the current healthcare system across Mississippi.
Tim, yesterday in the press conference when the president was mentioning the reopening, he made some, and I thought was cogent, the thoughts that I haven't thought about before. But he says there is a viable, tangible reason to get this back open as far as healthcare is concerned, because there are, and he mentioned a lot of things as far as mental health and everything else, and mental and financial health. But the other part of this was there are a lot of people who need to go to the hospital, and whether it's elective surgery or some of the people who may be hurting with back problems or things like that, and they've just stayed away from this.
Yes, they have, and it's amazing the global phenomenon that has occurred. That having a conversation with a cardiologist the other day, and even individuals with chest pain have second thought whether they needed to go to the emergency room or not. I had an example of a stroke patient last week that felt like something was wrong. They didn't feel good, but they thought, okay, I can go to the ER and maybe get COVID-19, or I can just kind of wait and see what happens. Well, they suffered a stroke, and it was 3 or 4 days later before they realized what had happened. That is not the right approach. We need to let folks know. Certainly, as we said earlier, if you feel like you have a COVID symptom, then the ER is not the place to go. But for other folks that need medical attention, the emergency room is there. It's always been there. And, I think maybe all of us didn't communicate that as well as we should have, in the fact that our hospitals are always there to do what they need to do to take care of patients. So I appreciate you mentioning that, Paul. That's a very, very valid point.
Yeah. We had 9 less reports yesterday of cases, total cases. We had, I think it was 4 less deaths in the state. As far as where you think peak will happen, you think it's underway now, and how long do you think it's going to take for us to begin to see a decrease in this?
Sure. And I tell you, some of these numbers that you're seeing now still, Paul, are delayed test results coming back in. They have gotten much, much better. So please take that as that has improved. You don't have the long waits that you did have in most cases. But still, some of those test results were probably done several days ago. So if you start seeing those numbers continue to decline, then very likely we are at a plateau. And I certainly hope that's the case. As far as predicting what could happen, I think there's still models out there that say we are close to the plateau. If you start talking to some of the hospitals across the state, they feel like in some areas of the state that they have already plateaued. And I hope that's the case. We do not need to stop doing what we're doing, though, from the standpoint of the social distancing.
I think that's going to be long term. When you start looking at the guidelines of phase 1, I think the president's absolutely right, and some modicum of that, some parts of that, we're going to have to continue for the next, I think, a couple of years until we can get either herd immunity from most of these people, or the other thing is to get some type of vaccine. But we've got in this state 3,624 people who were confirmed. Again, we don't know how many are still in the hospital. I don't have that number. Do you? How many people at any one time are in the hospital in our state?
I do not have that number. The health department would have that number, but I do not have that in front of me.
Well, but can you hold on for a second?
Absolutely.
The test accuracy of the test that we are using apparently in our state is 86% accuracy. Is that what you hear? About 86%. We'll ask Tim Moore when we return. More in just a second. Back to Tim Moore, President and CEO, Mississippi Hospital Association. We were talking about several different things. I got to ask you this, though, because we talked about it a little earlier. As far as the reimbursements are concerned, one of the big stories out there is that a lot of these certifications that it was COVID is kind of being questioned. Is it, or was it not? Because it seems to be that the government's paying more if it happens to be COVID and not just the regular flu. What's your statement to that?
Well, typically, when these patients are admitted and have COVID, what actually admits them to the hospital is an underlying condition. Whether it be pneumonia or them having a comorbidity that increases their risk of a very negative outcome with COVID. So that's where that comes into play. Hospitals, if you're treating a complicated case of COVID, ventilator, massive treatment, steroids, and all the other things that go involved with all the IV lines, the protective equipment, I assure you what they're getting reimbursed will not cover the cost of taking care of that patient.
So is it about $200,000 per patient in the state of Mississippi?
I have not seen a number that high. A typical patient that I've seen numbers nationally now, not on Mississippi, but national, because typically in Mississippi, you've got one of the lowest charge rates in the country in Mississippi. So it'll be less than what I'm about to say. A typical COVID patient hospital would run around $20,000. If they are in a more complex situation, they're in ICU, that number will be much greater than that.
Yeah, go ahead. I'm sorry.
So what we're doing is you're creating a very high-cost patient in a number of our hospitals, and they're seeing a double effect here, double negative effect, because their elective cases, the other patients, referring back to just what you were talking about, the emergency room a while ago, patients have not come to the hospital. Many of our hospitals are reporting decreases in volume and in revenue of 30 to 50%. Okay? That creates a high-cost patient that you're taking care of, that you're not going to get reimbursed probably the full cost on, plus you don't have additional revenue coming in from patients that you would normally take care of. So hospitals across the state of Mississippi are not faring well throughout this. I heard earlier one of the clips, and a lot of money came into Mississippi, but a lot of money when it comes to the cost of operating a hospital has not gone to hospitals.
So what you're saying, even though they had more patients coming in and they got full reimbursement, and the reimbursement is going to be guaranteed by the feds, and they got more patients, it's been a negative and not a positive to small hospitals?
It's going to be a negative because there really were not a lot more patients. It's a negative flow of patients. We've had some sick patients, but we have not had an overabundance where the hospitals were full of patients.
Do you think that's the case across the country or just in Mississippi?
Well, I think we have been very fortunate, Paul. I think because of our rural status, even though we're very hospitable people and we do a lot of hugging and handshaking, we responded very quickly.
Yeah, but there's a lot of rural states out there, because that's not what we heard. Every hospital is going to be we got to put up tents out there to house these people.
Yeah, and that has not been the case. And I think we should have looked probably a lot deeper into the true capacity of our healthcare system in the state of Mississippi. Because as I just told you a while ago, yesterday we had 2,700 empty hospital beds across the state of Mississippi.
So we didn't have to open up Camp Shelby or something like that.
Well, and Camp Shelby, in all fairness here, is a last resort. That was to be in place should we exceed the capacity of the existing healthcare system.
Don't get me wrong. I'm not knocking people who are just looking for a worst case scenario and be prepared. They should have done that. But I'm just saying we never reached that point. And really, that's good news. The test results on these things of 3,000, what did I say it was? 3,624 and is 86% accuracy. So we could have, and I put the numbers in here, 508 of that 3,624 that may not be, that possibly could have been something else, but the accuracy is 86%. Is that what you hear as far as the accuracy of this test?
Yeah, I think that is pretty close to the situation. If the physician seeing the patient thinks the patient has a 50% chance of having it or not having it.
Yeah.
If you go back to the China numbers and start looking at what they came up with, about 60% of the time you were able to correctly identify a positive patient. 90% of the time you were able to correctly, let's not say positively, but correctly determine if the patient was free of disease, which is now here. That's our problem, is finding those positives. We early on, because of the length of time that it took to get test results back, coupled with the fact that many of these patients actually could be ruled out when the test came back.
Yeah.
Okay, and then there were false negatives that were affecting. So then all of a sudden you have a super spreader that is able to go out and mingle with their family and everyone else, and then you compound your problem. What we've seen in our hospitals is a patient waiting on waiting on test results burns much more PPE than a patient that you know has COVID. Because they have to be handled completely different. Every time you go in and out of that room, you have to change your attire. Okay, if you have a ward of or a group of rooms that have COVID patients in them, some of that PPE you can keep on and maintain because you all have the same disease. Okay, so that has been a huge issue and greatly increased the burn rate of PPE and created our problem on the front end because we could not positively identify these patients quickly enough.
There's a viral video that, and I hope people have seen this. And I think we're talking about ringing the bells at 6 o'clock every night for the nurses, the doctors, the assistants, everybody in the health care field. And that video I think it says it all. One of the patients got off the ventilator and was breathing on his or her own, and the entire staff was dancing and singing, and they just happened to be caught on video, and it went viral. But it shows you that the amazing men and women who are doing this, putting themselves at risk. And I hope everybody has a chance to see that. By the way, the death toll in the Chinese city of Wuhan, where this thing started, apparently in the last 24 hours, they've revised their numbers. Wuhan is attributing the drastic uptick from 2,579 to 3,869 to fatalities, to insufficient admission capabilities at the hospital. So does anybody believe that these people have just 3,869 fatalities in that city? And I don't think anybody believes that, even though they revised it upwards. Your final thoughts, sir?
Paul, one thing, I appreciate very much you making the comment about our healthcare workers and first-line responders, because they have done an outstanding job, all the way from administrators trying to make sure that their hospitals had what they needed to the people on the front lines that were taking care of those patients. We need to do a major shout-out. I appreciate the Lieutenant Governor pushing forward with the bell ringing. That certainly recognizes those individuals that are out there fighting this on the front line. Remember your hospital's there. Remember that if you need your hospital, go to the hospital if it's a non-COVID event. And there are other avenues to get you taken care of from that standpoint. But our hospitals are always there to take care of our patients.
There is so many things happening. Even in our state, we're working on some new testing and even a vaccine. But there is reports now that when Wall Street opens in a moment or two, it looks like it's going to be on the uptick. There is information out there that began yesterday, not only with the presidential news conference, but also some new drugs that may prevent this. And it's one of the things that's also viral this morning. So a lot of things. By this time, I hope in a couple of 3 months, we will have tackled this thing and on our way back to normalcy at least next year at this time. You think?
I hope so, Paul. I have been looking a lot, and there's a great video on YouTube that relates what's going on now back to 1918, the Spanish flu, and the similarities that are involved. If that be the case, then, of course, we may have some more of this to look for, and we know there will be spots that we have to deal with this going forward. But I think we're smart. We have to be smart. This is not something that we can just shut down things and leave it shut down. We are going to have to learn to live with COVID-19, and we're going to have to live with it for a while until a vaccine is created. We have to be smart doing that.
Well, as young people, we went through this with something called polio and smallpox, so it's nothing new for baby boomers. Tim, it's always good talking to you, sir.
You too, sir. It's a pleasure.
Have a good weekend, and we will talk to you later.